Hi, my name is Van Morris, and I'm an assistant professor in the Department of Gastrointestinal Medical Oncology at MD Anderson Cancer Center in Houston, Texas. And I'm happy today to present the results of the NCI 9673 study. This was a phase 2 trial of Nivolumab for patients with refractory metastatic squamous cell carcinoma of the anal canal. So before I begin talking about the results of the trial, I'd like to give a little bit of background about anal cancer first, since this is a rare disease. So around 7,000 new cases of anal cancer will be diagnosed in the United States in 2016, and this number continues to rise year after year. There are multiple risk factors associated with the development of anal cancer, including immunosuppression and compromised immunity. And we know that the vast majority of patients, when they present with anal cancer, will have early stage disease that can be cured with chemoradiation. However, in around 15% of patients who have anal cancer, they will ultimately develop metastatic disease. And as this is a rare and relatively understudied disease, there's no consensus standard of care for the best way to treat patients with metastatic anal cancer. So we were interested, especially given the fact that with that, no prior phase 2 clinical trial had ever been completed for patients with metastatic anal cancer, in pushing forward and developing new effective therapies for patients with this disease. So we know that the most common or the most important driver for the development of anal cancer is infection with the human papillomavirus. In a series that we did at MD Anderson of 75 patients with metastatic anal cancer, we were able to detect HPV in up to 95% of these patients. So given the fact that this is known to be a virally driven tumor, we thought that the use of immune checkpoint agents may be an effective approach to treating patients with metastatic anal cancer. So the design for the study that we presented this year at ASCO was for single agent Nivolumab in patients with metastatic anal cancer. This was the first study that we're aware of in which patients who were HIV positive were allowed to participate, granted that their CD4 count was greater than 300 and they had undetectable viral loads. And the way that the study worked was we treated 12 patients in the first stage. If one of these patients had a response, then we were allowed to expand out 25 additional patients for a total of 37 patients. Patients were required to have squamous cell histology. In other words, patients with adenocarcinoma of the anal canal were not eligible for this particular study. They must have had at least one prior treatment of this disease, and as I mentioned earlier, co-infection with HIV was permitted. PD-L1 expression was not required for participation, and patients were not allowed to have had prior immunotherapy. The primary objective was to evaluate the response rate by RECIST 1.1 criteria, and secondary objectives looked to assess progression-free survival, overall survival, safety and toxicity, and then translational biomarker work that was taken from paired biopsies and from serial blood samples. 39 patients were enrolled on this study between May of 2015 and October of 2015, and 2 of these patients were screen failures. This left us with 37 patients who were evaluable for toxicity and as part of our intention to treat analysis. And we ultimately had 34 patients who were able to be evaluated for response to Nivolumab. As you can see here, the median age was 56 and 87% of patients were Caucasian. We saw complete responses in 2 of the 34 patients and partial responses in an additional 7 patients. This left us among the 34 patients who were evaluable for restaging studies with a response rate of 27% in 9 of 34 patients. And as you can see in the waterfall plot here, for the patients who responded, there were deep responses with dramatic reductions in their tumor size. As part of the secondary objectives, the median progression-free survival was around 4 months. And if you look at the tail end of this, there were patients who had durable responses and still continue to be treated as part of this study. And here you can see one of our patients who had a response. This patient, as you can see in the figures on the top, had multiple large lesions in the liver. And over the course of time, these lesions significantly shrunk in size. Overall, Nivolumab was very well tolerated among the patients on our study. Fatigue was the most common side effect. So to conclude, anal cancer is a rare disease, and as I've talked about earlier, the annual incidence of anal cancer continues to rise in the United States. This was the first prospective phase 2 clinical trial ever completed for patients with previously treated metastatic anal cancer, and Nivolumab was well tolerated and demonstrated efficacy in a fraction of patients who were treated with this agent. At AACR this past year, we did report the results of the translational studies in which we analyzed differences among the responders and non-responders. And this study accrued very fast and demonstrated that the ET-CTN network is a very good way of conducting trials for rare understudied malignancies. I'd also like to keep in mind that for patients with treatment-naive anal cancer who have never been treated, the INTERACT study is a randomized phase 2 trial comparing cisplatin 5-fluorouracil with carboplatin paclitaxel. And there are other studies coming out for patients who have had prior therapies. I'd like to thank all the collaborators and the patients and their families who enrolled on this study.